This is a look at the hospital in Chiang Rai, Thailand right now. The first 4 people pulled from a nearby cave on Sunday were taken to this hospital minutes after they were pulled to safety. So far, officials have not released much information about their condition. Joining me now by phone is Dr. Andrew Adesman, the Chief of Developmental and Behavioral Pediatrics at Cohen Children's Medical Center of New York. Thanks for joining us this evening. These are young boys and men, 11 to 16 years old. This will be an incredibly traumatic experience for them. I wonder what you would expect their condition to be in the weeks and months ahead, and how you would deal with that. What do you try to do for a young man that's come out of a situation like this?
Well, obviously, this is a very unique and unusual situation, and I think that it's fortunately the worst is behind them in terms of the uncertainty of whether they're going to survive, whether they're going to be rescued and the like. And at this point, there's considerable resources working to rescue them. And as you know, 4 boys have successfully made it to hospital, and supposedly the boys are in very, very good shape, although specifically I believe the strategy was to take the healthiest boys out first. So time will tell whether ultimately, as planned and hoped, everyone gets out successfully. But in terms of down the road, it's going to be, quite a bit of an adjustment for these kids. On the one hand, they're going to be celebrities. There's going to be, in terms of survivors, there's going to be some fairly acute medical investigations, making sure the boys are healthy in terms of, specific infections. Obviously, there's elements of acute malnutrition and dehydration that are going to be addressed. And then I think, the greatest concerns, or at least in terms of beyond the next few weeks, are the potential for emotional problems. There's a risk of PTSD, although I think that that's unlikely for most of these kids. I think that for most of the boys, the greatest likelihood is that there'll be some adjustment issues in the weeks and maybe the first few months after their rescue. And
can I ask you why do you think PTSD is unlikely in this case?
Well, PTSD, in terms of protracted problems, clearly this has been a major stress. We're not aware at this point of any decompensation within the cave to date, although obviously there's limited information. But I think that I think that there's a likelihood of resilience. I think that, assuming everyone comes out, there's no fatalities. I think the worst is behind them, and I think that, yes, there may be issues in terms of some nightmares or possibly flashbacks for these kids, but typically I think the experts are suggesting perhaps 10 or 20%. So if you have 12 kids, we're talking about 1 or 2 boys that's the greater likelihood where this may be a protracted problem. I think that overall I'd be optimistic in the long term for these boys.
What would you tell their parents?
Well, I've been reading that the parents may have to wait a little bit. I think the doctors may delay some of the reunions, which I'm not sure if that's wisest, but the bottom line is I think that's erring on the side of caution around physical health issues and infection. But I think that the parents also need to be given a very hopeful message. Obviously this has been a traumatic event, hopefully, again, happy outcome in the end. And I think parents need to know what to look for in terms of possible signs of PTSD, whether it be sleep difficulties, whether it be nightmares, flashbacks, concentration issues, possibly impulsive or aggressive behavior. But the other thing to keep in mind is that these kids are going to get the very, very best possible care. They're going to be monitored. I'm sure everything's going to be done to try to evaluate these kids in the short term and the long term, and they're going to have full resources, I'm sure, of the Thai healthcare system to make sure that these kids get whatever treatments are necessary acutely, and that things don't get out of hand over time.
And mentally, what are the treatments that would be needed?
Well, for PTSD, if that's what we're talking about, the best treatment out there is a form of psychotherapy called trauma-focused cognitive behavior therapy. It's a form of direct intervention psychotherapy, either with most likely a psychologist, possibly other mental health professionals, and it involves children or teens in this case, revisiting some of the trauma, talking about it, and then through various stages of therapy, becoming more capable of coping with the emotional trauma that occurred or that may be residual from the physical event. Apart from treatment with CBT, occasionally medication is used, and that can be either antidepressants, some of the SSRIs.
And remind us what CBT is.
I'm sorry, cognitive behavior therapy. So cognitive behavior therapy is first-line treatment. In terms of psychotherapy, there are other forms of psychotherapy that are sometimes used. And I think that, as I said, medication can sometimes be used as well. But I think in these instances, there's going to likely be some mental health assessments and counseling engagement to the children, engagement interactions and counseling for the parents, and then it'll be a wait and see. I don't think we should presume that the majority of kids are going to have major problems. I think hopefully the majority of the kids will do well once they've made some adjustments in the weeks ahead.
Okay, a happy thought on a pensive night. Dr. Andrew Adesman, thanks so much for your thoughts.
My pleasure. Thank you.